Hi, I'm Dr. Patel, and I'm the preferred and gold provider of Invisalign and Serenity Dental. So I want to talk to you a little bit about the acceleration of Invisalign. It's in conjunction to the treatment of Invisalign that you will be getting. This accelerates the procedure. Essentially, it cuts your time in half. If you have 12 months of treatment, you're going to get 24 aligners. Well, you still get your 24 aligners, but now instead of changing your aligners out every 2 weeks, you're going to be changing them out once a week. So your treatment will go from 12 months down to 6 months. So PROPEL and VPro5, these are the two ways to accelerate the procedure. So let me kind of quickly give you a brief idea about how teeth are moving. Essentially what happens is when you put force on a tooth, your tooth just won't move by itself. You've got some solid bone at the bottom that something's got to happen down there in order for that tooth to move. So biologically, when you put force on that tooth, you're going to get a set of cells that come in, they're going to soften that bone up, your tooth is going to move, another set of cells will come in, it's going to re-harden the bone back up. That's how all types of orthodontics works, Invisalign and conventional orthodontics. It's a it's a softening and re-hardening and moving of bone. That's the whole process of it. So what PROPEL is that we're actually doing that first step. We're going to soften that bone up so your cells don't need to come in anymore. Your teeth can start shifting and the other cells will come in to keep on re-hardening that bone back up. So PROPEL, the in-office treatment, it's a one-time treatment in the office. We will get you numbed up, give you anesthetic where we need to on those particular teeth that need significant movement, and we use this little tiny little PROPEL tip and we make a small little 1 millimeter concave divot right into the bone. So now we're putting force on that tooth because of the tray. We've caused that little softening by the PROPEL tip. So now these cells don't need to come in to soften up. Your tooth will start to move. The other cells come in to re-harden the bone. You can change your aligners at a rapid pace once a week. You'll be done in half the time. The other way is the take-home procedure called VPro5. So VPro5, you're going to use it twice a day, 5 minutes each time. It has a 5-minute timer already built into it. So what you're going to do in the morning, you're going to wear your trays, bite onto this little silicone base, push the button, it'll sonicate for 5 minutes, and essentially what you're doing now is you're sonicating that bone, you're softening it up. These cells don't need to come in to soften the bone anymore. Your tooth will start to move, the other cells come in, they re-harden the bone. So same process, you can change those trays out once a week, cutting your time in half. So both of these treatments have been around for quite a long time. PROPEL, the osteoperforation treatment, this has been around for about 100 years now. Different types of ways they used to do it 100 years ago, but the same similar process. Again, a lot less invasive nowadays. But this treatment actually has been around since 2009. The sonication treatment, same thing since about 2009. We've been doing it in our office since about 2013 or so now. So it's a great treatment for patients who have at least 1 year of treatment, so they can cut that time in half. Even if you have to have extra or additional aligners made, that treatment time will also be cut in half as well. Essentially, this will give you better advancements, better treatment time periods, and also more predictable movement because we know those teeth are really constantly moving all the time. Patients have less discomfort. Again, with Invisalign, you don't have much discomfort to begin with, but less tension on the teeth as well because the teeth are just constantly moving. There's not a move, stop type of sensation. It's a constant moving sensation. So you don't have that discomfort when you change your new aligners out. If you have any other questions regarding PROPEL, we can all answer them for here at Serenity Dental.